and welcome to Talking Data Equity for Friday, May 24th. My name is Heather Kraus, and I'm the founder of an organization called We All Count, which is a project for equity in data. And we provide trainings and tools for anybody that wants to align the choices that they're making in quantitative work with the values and priorities that the research is trying to center and prioritize. One of my favorite things that we do here at We All Count is that most Fridays at this time, noon Toronto time, is we host something called Talking Data Equity. And if this is your first visit to Talking Data Equity, we are very, very excited to see you. Welcome. And if you're a regular at Talking Data Equity, thank you again for coming back. And what we do at Talking Data Equity is we have informal conversations about techniques and processes and ideas that help anybody who wants to embed equity in their work figure out how to do that. And sometimes we have special guests, and this is one of those weeks. I'm going to introduce you to our special guest in just a minute. Before I do that, I'm going to do a tiny bit of housekeeping. You will see that this is in fact being recorded. The reason it's being recorded is so we can share it with the data equity community at the link that I just shared there, because there's lots of people that are working on data equity projects that can't join us at this time. So we want to make sure that they can still have access to all of those resources. Secondly, this is a Zoom meeting that usually has 100 or a couple hundred people in it. So while our guest speaker is sharing their slides and sharing their stories, we do ask that you keep your microphone turned off. Feel free to do your conversations and ask questions in the Zoom chat. You can put your questions or your comments in the Zoom chat where everybody can see them, or you can just direct message me if you would rather share in an anonymous way, and I will amplify your question. But we do ask that while our guest speaker is sharing their slides, that you do keep your mic off for that time period. Okay, so enough about the logistics. Let's get to our very, very exciting special guest. So I am happy to tell you that after a long time of looking at dates, we are very, very happy to welcome Gwynne Evans-Lomayesva, Snow Clan from the Hopi Tribal Nations. And Gwynne is a joint demography and sociology PhD student at the University of Pennsylvania. She's a recipient of the university's Presidential PhD Fellowship and the Fontaine Fellowship. Gwynne has a passion for demography, which emerged during her years working for the census data and collaborating with demographers and sociologists in the field. She's passionate about incorporating the American Indian and Alaska Native population and geographic population data into her research and working to improve AI/AN data representation in research. Gwynne joined the university from the National Congress of American Indians Policy Research Center, where she served as the center's researcher from 2018 to 2022 and led their Policy Research Center's Census Information Center for 3 years, which is a big deal if you're not from that sector. Gwynne joined the National CIC Networking Steering Committee in 2019 and was elected chair in 2020, where she served until 2022. And she continues to serve the Census Bureau through her appointment to the Census Scientific Advisory Committee in 2022. Gwynne's research right now explores health and birth disparities by racial and ethnic groups with a particular focus on American Indian and Alaska Native populations. And when we share the video that we're going to generate today. We're also going to share the resources and the links that I've just referred to here. We'll make sure that you can access all of Gwynne's work. And I will now stop talking and turn it over to Gwynne. Thank you so much for joining us. I know that you have been incredibly busy, both as a student and as a practitioner in many, many influential positions. Let me turn it over to you, Gwynne. Thank you for joining us.
Thank you so much, Heather, for inviting me. And thank you, everybody, for having me here today to talk to you about data equity for the American Indian Alaska Native population. All right, can you see my slides?
Yeah, it looks great. It's perfect.
Awesome. Thank you so much. All right, so as Heather had said, my name is Gwynne Evans-Lomayesva. I'm a Hopi tribal member and a joint PhD candidate in demography and sociology at the University of Pennsylvania. I'm also an affiliated PhD student with the International Max Planck Research School for Population, Health, and Data Science. Throughout my research and this presentation, I aim to bring the American Indian Alaska Native population into data analyses where they're often not included for a variety of reasons that we'll cover. If you hear me say AIAN, please know that I'm referring to the American Indian Alaska Native population, and I'll try not to use the acronym, but it does slip out sometimes. All right, so here's the outline for today's presentation. First, I'll cover a very brief introduction to the tribal nations and who the tribal nations are. This is so all of us start with a baseline understanding of the tribal nations in the United States. Some of you may already know this information, some of you may not. This is really just to get us on the same baseline level. If anybody wants more detail into an introduction in the tribal nations, I'm happy to share a report by the National Congress of American Indians on tribal nations in the United States, an introduction. It is a fantastic introduction report. I highly recommend it. All right, so after this introduction, we're going to begin to dive more into the data and understanding the defining population of American Indian Alaska Natives and different ways to categorize or look at this population and why this is so imperative to determine the differences in the analysis and your interpretation. And so then we'll move into challenges with data collection and that create a lot of barriers and deter folks from including the American Indian Alaska Native population into their analysis. The final section of the presentation before questions will provide a research example for why inclusion of the American Indian Alaska Native population into analyses by racial ethnic groups is important, and also different ways of possibly overcoming some of the challenges that we addressed in the prior section. And then we'll open it up for questions and discussion. All right, so if you leave here today only retaining one thing, I really hope that it's an understanding that there are several different measures to look at the American Indian Alaska Native population. And these measures capture potentially very different groups of people. And so knowing that the population that you're looking at is pivotal for understanding and interpreting your results. So if that's only one thing you retain, if you leave here retaining two things, I hope that the second is why it's necessary to include the American Indian Alaska Native population into your analyses. And then if you retain three things, I really hope you remember the data challenges in collection so that you may work to better improve data collection, or you may include these challenges in your limitations and possible adjustments to your methodologies. All right, so first we're going to begin with the introduction to the tribal nations and tribal geographies. We start out by looking at defining what a federally recognized tribal nation is, which I will refer to as tribal nations throughout the presentation. A federally recognized tribal nation is a legal term within U.S. federal policy. The federal recognition status of a tribal nation denotes the United States' acknowledgement of a tribal nation's political status as a government. With this, tribal nations and the federal government engage in a government-to-government relationship. The Department of Justice defines tribal nations as possessing certain inherent powers of self-government and entitlement to certain federal benefits, services, and protections because of a special trust responsibility. One of the ways we see this is through the requirement of tribal consultation. There are 574 federally recognized tribes in the United States that are located across 35 states and within the geographic borders of the United States. However, each tribal nation exercises its own sovereignty separate from each other, and they have their own systems of government, their own constitutions, their own elections, jurisdictions, and they create their own rules of citizenship. So these vary tribe to tribe. All right, and then when we think of tribal lands, there are several different tribal geographic areas that tribal nations may have jurisdiction over. Most folks will immediately think of the American Indian reservations when thinking about tribal geographies. The federal American Indian reservations and off-reservation trust lands are reserved, or are lands reserved for tribal nations or a tribal nation under a treaty or other agreement with the United States, executive order, federal statute, or administrative action to create these as permanent homelands. It's important to note that not all tribal nations have reservations, and those with reservations are not necessarily located on their traditional homelands. These are not the only types of tribal geographies either. So we're going to define Indian country, which with the lowercase c I have underlined here, this is also what classifies. This is the legal term. You can have Indian country with a capital C, which is a little bit different. But Indian country, lowercase c, are the geographic areas under tribal jurisdiction, which include land with reservation boundaries, dependent in Indian communities, and Indian allotments. These are the official types of jurisdictional tribal geographies. However, there are also other types of geographies we may use when looking at the American Indian Alaska Native population. The U.S. Census Bureau creates a category called American Indian Alaska Native Native Hawaiian Homelands, and these include all of the different types of tribal geographies listed here. Some key geographies you should look at are the Oklahoma Tribal Statistical Areas and Alaska Native Village Statistical Areas. As I previously said, not all tribal nations have reservation lands, and so often these may become really important to capture tribes on geographies that are not necessarily tribal lands, or not necessarily reservation lands. All right, so this will hopefully help clear this up. This is a map created by the U.S. Census Bureau of all of their different types of tribal geographies that they capture. In green, you have here the federal American Indian reservations and off-reservation trust lands. In Oklahoma, you can see these Oklahoma tribal statistical areas in blue. And this is where you can start to see the importance of including these other types of tribal geographies, as if you're only looking at reservation lands in Oklahoma, you're going to miss a huge portion of the American Indian Alaska Native population on these geographies. Also mapped here, you can see in this dark purple color, these are the state American Indian Alaska Native reservations, and state designated tribal statistical areas are in light purple. This just gives you an idea of the spread of many of the tribal nations and also the different types of geographies that they cover. Right, here's the same map, but this is just a focus on Alaska. And again, this really highlights the importance of using all of these different types of geographies. For this one, the Federal American Indian Reservation is in green again. And everything in purple are all of the Alaska Native Village Statistical Areas. In Alaska, there are 228 tribal nations, and there's only one federal Indian reservation. This highlights why, again, it is so important to think beyond just the reservation measurement. All right, so here's our one and only slide of audience interaction. This is just to, again, put it all at the same baseline. Now that we have a general idea of what federally recognized tribal nations are and the large geographic spread throughout the United States, who remembers or has a guess at how many federally recognized tribal nations there are in the United States? You just want to type your answer in the
547, 574, over 500, 574. Yeah, 574.
Hi. This is fantastic. So many people guessed so much lower. So I'm glad everybody was listening. There are 574 federally recognized tribal nations in the United States. And these tribes gained federal recognition through acts of Congress. And the most recent tribe to gain federal recognition was the Little Shell tribe of Chippewa Indians in Montana in 2019. All right, so how many folks have a guess on how many federal and state recognized American Indian reservations we have in the United States?
Over 600 is one guess.
Right.
That's the only
So
guess.
that is a great.
Nobody is sure.
Okay, that's okay. I was going to say that is a great guess, but and this highlights why it's so important to think beyond just these boundaries. Is there are only 334 federal and state recognized American Indian reservations in the United States in 2019, and the total land mass estimated under these American Indian Alaska Native control, again as of 2019, was about 100 million acres. And this would make, if all combined, would make Indian country the fourth largest state in the United States. All right, so now that we've covered the basics of who the tribal nations are, what federal recognition is, and different types of geographies and why it's so important to consider different types of geographies, we're going to look at defining the American Indian Alaska Native population and the challenges associated with data collection and analysis. Right, so there are several different ways to measure the population. The main ways that many folks will know are the OMB, Office of Management and Budget, Race Ethnicity Standards. Now you'll see here I have a section crossed out. This is because in 2024, the American Indian Alaska Native racial category was changed to remove the who maintains tribal affiliation and community attachment part of the definition. However, if you're using the OMB racial category in any data analysis right now, nobody has implemented this yet. This is brand new. So you'll still need to use this definition when using with the who maintains tribal affiliation and community attachment when you are conducting analysis. So the American Indian Alaska Native racial population, this is all self-identified data. This can be anyone who selects that they identify as American Indian Alaska Native, either alone or in combination. So this will cover a very large population. Next, you can look at some of these tribal geographies that we identified earlier to try to create a proxy of folks who fall under tribal jurisdictions. And this can be important if you're planning services for a specific region or area. You need to know who lives there. However, it's important to know if you're looking at the population within these tribal jurisdictions. One, if you're using the American Indian Alaska Native, Native Hawaiian category, you're going to need to remove the Native Hawaiian geographies because they have, the Native Hawaiian Pacific Islanders have a very different relationship with the federal government and the American Indian Alaska Native populations. If you want to keep these together, you're going to need to define the population you're using, but it is not just the American Indian Alaska Native, you're also doing the Native Hawaiian Pacific Islanders. So this is just one of the things you need to consider when using the American Indian Alaska Native geographies. Similarly, when using these geographies, you're not going to have just American Indian Alaska Native in these populations. You will have people who are outside of that racial category. So these are just things to keep in mind when using these different populations. Finally, the other main population that I'll cover here, these are not the only ways of measuring the American Indian Alaska Native populations, but the main ways I'm addressing here are the American Indian Alaska Native political legal status. Now, this is a person who's enrolled in his or her tribal nation and is a citizen of their tribal nation. This could also be called enrollment, enrollee, member, but these requirements for membership are set by the tribal nation. This data is created, defined, maintained, and owned by the tribal nation. If you want to work with this data, you need to build a relationship with the tribal nation. They're not required to share it with people, and they can set the rules of engagement of how to use their data and have final say over what is produced. I will say I've used all three of these categories in my analyses, and they can all be really useful for measuring the population, creating analyses of the population, but really just need to be defined of what you're looking at and make sure you're not interpreting it as something it's not. All right, and just here's some examples of key uses for American Indian, Alaska Native race data, geographic population data, and legal status population. Some of the challenges associated to American Indian, Alaska Native data collection are, one of the main ones we know are the small sample sizes. Very difficult for many reasons to get people to respond to federal surveys or any surveys, and you can have a low response. One of the reasons for this might be distrust in researchers in the federal government. There's a history of bad research with the American Indian, Alaska Native tribal nations. There's also high costs associated with surveys on these lands due to rural and remoteness. And all of these kind of combine to make it really difficult to create a good data set. However, it's really important to overcome some of these small sample sizes. Some folks, what they'll do is they will see the small sample size of American Indian, Alaska Native in their racial categories and will just remove it from the analysis, that entire population, or they'll asterisk the population at the bottom of a survey, just saying there wasn't a big enough sample size. And this may be fine for them, but it's not helpful for the population at all. One example of why this can be problematic is one that often the American Indian, Alaska Natives are removed from a lot of processes or understandings of disparities, and so we don't know how to allocate resources appropriately. Further, some folks will use these small sample sizes and make really generalizable interpretations where they shouldn't be generalizable. There was a really often cited federal survey that had 88 female American Indian, Alaska Native respondents and 105 male respondents, which meant there were fewer than one person for every tribal nation in this data set. And data was only removed when there were less than 5 responses to each question. The responses for this, or the analysis for this data set, were widely used for many years and interpreted as generalizable to the entire American Indian and Alaska Native population. This is less than 200 people in the survey that's generalized to an entire population. Many years later, another federal agency had conducted an oversample of this population, and this produced a much better sample size. I want to say it was about 2,000, and the findings from that both confirmed the earlier results, but also found even greater disparities, which then allowed for more resources to be sent into this area of concern. I don't want to shame the survey, so I'm trying to be delicate about that. But these are just some of the challenges that really make it difficult to analyze the population or interpret it correctly. All right, so the next section, I'm going through an example of disability disparity by racial ethnic group, and I'll also talk about some of the ways to overcome some of these challenges to the data. If you want to learn more about data equity and different federal surveys and analyses, please take a look at this report that was co-written with folks from Georgetown University's Economic Security and Opportunity Initiative. The report also provides more background into measuring and understanding the American Indian, Alaska Native population. So you'll receive more understanding of additional ways to measure the American Indian Alaska Native population. All right, so looking at the challenges in data analysis and why the American Indian Alaska Native population should be included in analyses, we're going to look at my research on factors explaining disability disparity between the American Indian Alaska Native population and bridged racial ethnic populations. The motivation for this research stems from a lot of research in disability that focus on disability disparity between racial ethnic groups, often citing that the American Indian Alaska Native population has the highest rate of disability among all racial ethnic groups. However, very few research will include the American Indian Alaska Native population into their analyses on disability disparity, even though they say and understand that they have the highest rate. So my research question focused on whether the same mechanisms associated with increased disability by racial ethnic groups applied to the American Indian Alaska Native population to understand this wide gap in disparity. So I used the American Community Survey disability questions. This measures 6 questions on functioning rather than specific health conditions. This was a switch that was made in 2008 by the US Census Bureau. Right, so prior research has identified educational attainment, sex, geography, or tribal lands, healthcare access, and military services as associated with health outcomes for the American Indian Alaska Native population, not just disability. And so for this reason, I include these as explanatory variables in my models. Studies that examine the American Indian Alaska Native population in disability often focus on populations aged 55 and above. This is problematic because the American Indian Alaska Native population is a very young population. So we're missing a huge chunk of folks who may be exposed to disability, and we're not understanding the full range of mechanisms that lead to this gap in disparity. Further, for education and sex, we actually, in the research that has been conducted at these older ages, found that the American Indian Alaska Natives have a female disadvantage, whereas other racial ethnic groups have a male disadvantage. This is of note to already understand that there are differences in disability disparity between racial ethnic groups. Further education, it explains some of the difference, but not all of the difference. And this is why it is needed to include in these. Geography, we look at the rurality of tribal lands and the association of rural-urban divides in disability. Finally, healthcare access. This can be limited by rurality, so where folks live in these rural tribal lands versus in urban areas, and also insurance access. There's a huge disparity in who can access healthcare and who can't based on insurance. Finally, the last mechanism we're going to look at is this military service. The American Indian Alaska Native population had the highest likelihood of disability, highest likelihood of no insurance, and are the youngest population of military veterans. This was done by a VA report in 2017. Also, another research project has looked at environmental hazards on health outcomes in Southwest and have identified exposure to military chemicals as one of the top 3 hazards for American Indian Alaska Natives. So these findings combined really make this an imperative variable to look at and include in analysis. All right, so my data comes and looks at the American Community Survey from the US Census Bureau 5-year population estimates. Now, I use the 5-year population estimates because this is one way to improve the sample size of American Indian Alaska Native populations. Single-year populations should not be used if you're also using tribal geographies. It's just not representative and often will be suppressed. So this is why it's necessary to have those 5-year population estimates. I limited my analytic sample to folks who had responses for all of my explanatory variables. And I also use predicted race as my racial category variable, which I'll explain in a moment. And my analysis looks at US born adults aged 25 to 64. All right, so what is predicted race and why is it? IPHONS created a predicted race variable using bridged data methodology, which is similar to Dr. Ingram's approach for the 2000 census, to predict a single race that would likely be selected by respondents if only one race option were permitted. This is particularly useful for improving American Indian Alaska Native data sizes to the diversity of the American Indian Alaska Native population. Here you can see the results for the 2020 US decennial census for the American Indian Alaska Native population. 9.7 million people identified as American Indian Alaska Native alone or in combination with at least one other racial group. 5.9 were American Indian Alaska Native in combination, and only 3.7 were American Indian Alaska Native alone. So you can already see that there's a huge diversity in who identify as American Indian Alaska Native. Using this bridged race category, you improve from this 3.7 to a much greater percent of the population and a lot more representative. Right. So here I go through the variables I use. I have my outcome of interest was disability. This is coded as a binary variable because I'm conducting logistic regression. My variable of interest was this predicted race ethnicity category. My explanatory variables were those identified from the background research, which is education, health insurance, Pumas with tribal lands, and military service. Now, how I categorize these and the groupings grow to, again, improve sample sizes. So Pumas with tribal lands, Pumas are continuous geographies throughout the entire US. These Pumas with tribal lands is a variable created by IPHONS, and they're categorized as with tribal lands if they have at least one census block that goes into any tribal geography. And then the research controls for age, census region, survey year, and gender. All right, so here we're going to look at the age standardized disability rates. So I create age standardized to make sure that this difference in disability rate isn't because of the population age distribution for each of these. And so I standardized to the average age distribution in the United States. Even standardizing, we can see that the American Indian Alaska Native population has a much greater risk of disability that compared to the other racial ethnic groups. Then I looked at period age-specific disability rates for the US born adults. And these are the not age standardized, these are just looking at the differences between each age group. Again, grouping by age rather than single year can help improve data categories for these and small populations. And you can see that every single age, the American Indian Alaska Native population still has this greater rate of disability compared to other racial ethnic groups. All right, here's, we're going to go through some of just the descriptive statistics for each of these populations. Here are the educational attainment gradients by predicted race ethnicity. The American Indian Alaska Native have the highest percentages under high school and under compared to everyone else. So we can see already there are some differences by education gradients that may play into differences in disability disparity. Here we have the population with health insurance. Again, the American Indian Alaska Native population has the highest percentage not insured. And you can see compared to the US average on the left, this is 2 times greater than the US average. Next, we go to the percent of population ever served in the military. And we can see that the Black African American population and the American Indian Alaska Native population are the 2 overrepresented populations in the military. Finally, we look at the percent of population living on Pumas with tribal lands. And here you really see a stark disparity of why it's really important to include this variable or a variable of tribal land, because where people live is very, very different by racial, ethnic group. And the majority of American Indian Alaska Natives live in these tribal land pumas, which are often rural and remote. And this may be indicative of different infrastructures or that may or may not exist. All right, so here's my models for the logistic regression. We start with baseline and then gradually add on the variables of interest. And all of these are run with person weights provided by IPUM. I also used Bayesian scores to determine the strongest model, and these were conducted as I went on. All right, so here are the results for all of the baseline, or all of the models, starting from the baseline at the top and going to the final model that includes all of the variables at the bottom. And what we can see, these are just the results for the racial category. We can see that the American Indian Alaska Natives in our baseline model have much greater odds of disability compared to the other racial ethnic groups. Now, what we would expect is if these other variables explained the difference in disparity, we would expect them all to be a lot closer to zero. However, we can see that while adding in education does explain a good portion of disparity, even adding all of these other variables, there's still a difference of American Indian Alaska Natives compared to the other racial ethnic groups of increased disability. And so what this suggests is that there are a lot more mechanisms that we need to understand to help decrease this disparity. These are my preliminary results for the interactions of race and each of these variables. As you can see, again, these are preliminary. Military service is a much greater odds for American Indian Alaska Natives compared to the other racial ethnic groups. What we can also see, though, is with educational attainment, as you increase an educational gradient, you would expect more of a protective benefit. However, we can see that for the American Indian Alaska Native population, their protected benefit is a lot lower compared to the other racial ethnic groups. And so this deserves a lot more attention as to exploring why this is such. Finally, we can also see this difference in opposite interaction for health insurance of the American Indian Alaska Natives compared to other racial ethnic groups. So we can see what we want to learn through this is that we can see these mechanisms don't work the same. And we wouldn't know they didn't work the same if we didn't include the American Indian Alaska Native population into the analysis. This is why it's so necessary to include them in these disability analyses, because otherwise we're assuming that these mechanisms work the same way when they don't necessarily. All right, so my finding summary. So although education explains some of these increased rates of disability for the American Indian Alaska Native population, the odds of at least one disability measure remained high after accounting for the hypothesized association. These factors don't capture all of the increased odds for disability, and more analysis into these mechanisms is needed to understand these disability disparities. The analysis is ongoing, and next steps for the analysis include interpreting the interactions, rerunning them, calculating and adding in confidence intervals for the interactions. I didn't have them in the preliminary results. Also considering running the analysis on gradient for disability. So there are 6 measures of disability. I created this as a binary. However, you still see that as increased numbers of disability functioning that people respond to increases, it still remains high for the American Indian Alaska Native population compared to other groups. This could provide additional insight. Finally, I'm looking to conduct a Winder-Lohaka decomposition to determine the percent of rate differences compared to composition in the population differences that account for these disparities. All right, so in conclusion, I think I've gone a bit over, I apologize. There are several ways to measure the American Indian Alaska Native population. So just be really clear on which population measurement you're using and be aware of the interpretation. There are also several challenges to data collection and usage in the American Indian Alaska Native population data, but you can overcome these challenges by putting the work in and building these positive relationships with tribal nations, conducting oversamples, being clear on proxy measures, and also how you categorize your variables. You may need to increase the years that you do. You may need to increase the buckets of analysis, such as for education. All of these can help overcome some of these small sample sizes. Finally, the American Indian Alaska Native population needs to be included in analyses examining disparities because the causal pathways and mediating mechanisms may function differently compared to other racial ethnic groups. That I say, Askari, and thank you.
Thank you so much, Gwynne. That was fascinating and extremely useful. And there's a lot of applause happening in the various Zoom ways to express applause, and lots of gratitude in the chat. Again, for people who want to get into the details and some of the nitty gritty of the methods, we will make sure that we post as many links and resources as possible when we also share the slides in the video. So no worries, we will make sure. And we do have some time for some Q&A and conversations. So if you're in the room and you would like to raise your hand, go ahead. Before I ask anyone to unmute, I'm going to ask the one question that I have received more than 12 times since Gwynne started talking, which is the change that you mentioned in the like that crossed out part in the definition that isn't being used yet, but is about to be used. I've gotten a lot of questions about that. And I think I could summarize the questions by saying, number one, do you know why that change was made? Let's just start with that. Do you know why that change was made, Gwynne? And if you don't, that's fine. We know that we're not asking you to speak on behalf of the US Census, to be clear. So just like, what's your impression?
Yeah, I think, I mean, I don't know for certain, but I do believe a part of this was pushed by the tribal nations themselves during consultations, because a lot of consultation and feedback went into changing these. So really, that's as much as I can say. I think
that's good.
I was just gonna say, I think there's been a lot of, over the years, different opinions by different tribal nations of whether or not to include this. So this is just an accumulation of all of that.
Great. Awesome. And we will maybe follow up and see if we can get somebody from the census to actually come and talk to us about that, because there continue to be lots of conversations about that particular sentence in the chat. So I really appreciate it. Okay, thanks for waiting, John. Go ahead and unmute.
Thanks, Heather. Hi, Heather.
Hey.
Thanks, Gwynne. This is more of a comment than a question, I think. You spoke a lot about the issues with the racial and ethnicity data in the ACS. I didn't hear you talk much about the really problematic issues with the disability data in the ACS. You know, it does not count millions of people who have mental disabilities and mental impairments, which is particularly for youth in tribal areas, is a huge, as I'm sure you know, is a huge issue. So I think in however you couch this work, I think that's a major issue that needs to be considered when talking about disability data, especially in correlations across racial ethnic groups when the sample sizes get to be quite small. There's as you may know, the Census Bureau's proposed changing how they're collecting disability data, and that set off a firestorm, both amongst the research community and politically. But I think you do need to be a little bit more careful on the disability data, because it's lacking in some fundamental ways.
Yeah, I agree with that. And I think there's no good measure for disability. So it really comes down to how you discuss it in the actual research itself. Because you're right, it's not a great measure, but my conclusion of going through several different data sets is there's no really good measure of how we're looking at disability. And there's so many different contentious ways of looking at it. So you really just have to be clear when you go through this. I do believe that the Census Bureau isn't implementing the proposed changes though, and they're conducting more research into it. Thank you for the comment.
Great point. I want to elevate another question from the chat, which is, I work in data science for a public library in a very diverse city with a non-negligible undocumented population. In an effort to properly account for and highlight the impact of our branch libraries on the community at large, we would like to incorporate the figures of undocumented folks. We rely primarily on the census data to do our analysis, which of course doesn't include this subset of the population. What methods do you recommend we utilize to account for this critical group of library patrons? So this is a really, really important question. And we actually do have a library specialist teed up in a couple of weeks. And Gwynne, I realize this is outside of your area of expertise, but you know, if you have any thoughts you want to share, I will invite you, but I really don't want to put you on the spot since we did specifically invite you to talk about different ways to measure American Indian and Alaska Native populations. But it is a really interesting question and not unrelated at all, of course. The whole issue of like documentation and how federal documentation changes who gets counted and how is very, very related to the differences that you've helped us understand.
Yeah, I do not work with
of course
undocumented, or I don't even often a lot of my research is restricted to the US born, and this is mostly because immigrant populations tend to have very different health outcomes, and so I cannot speak to how to measure or analyze or look at them. I'm sorry.
No, that's fine. We did not invite you here to talk about that, but it's very interesting. I really appreciate the question because it does draw a very interesting parallel about the whole documentation issue and how, you know, the census really is designed to inform us about what things look like from the state's point of view, a state being like, you know, government's point of view. So I think it is a very connected question, and we will try and get somebody in here to answer that question for you. And another couple of folks in the chat are asking about those tribal records. And you had mentioned in your conclusion, Gwynne, that like putting the time in to build those relationships is an important way to get that data, because there is no obligation to share that data. Do you have a first or a second step that you would recommend in order to start building those relationships for people who don't really know even how to start?
Yeah, this is a really good question. And so the National Congress of the American Indians used to have a phenomenal training program that I was part of that looked at tribal academic partnerships. And I would say the first step of trying to build a partnership with any tribal nation and use of their data is, one, you have to go in with a lot of humility. You are not part of the population necessarily. You may not, I mean, unless you're working with your own tribe, but oftentimes researchers are going in and not part of the population. You need to go in knowing that you are a visitor, you are being allowed to meet with people. They have no obligation to meet with you. And then also going in recognizing that as a researcher, as a federal agency, whoever you may be, you're going in carrying this history of distrust, and that you inherit this distrust that was established by just a history. I think in one of the big examples is in Arizona, where a researcher came in, was conducting research with one of the tribes, and then they brought a friend in. The friend, you know, conducted a lot of research, took some blood samples. The tribe didn't really understand, they didn't have consent. And then they produced a lot of really negative research about the tribe. And this is really harmful for the tribe. They ended up losing out on a lot of federal funding, a lot of funding opportunities, had a lot of negative stigma. And this is just one example. And so this history of bad research continues to reverberate throughout all the tribes. And so going in with humility, knowing that you carry this history, even if you didn't do anything, you carry this history. That is the biggest step of creating like just a first initial response. And then I would also say that it's really important to recognize that you're following their rules of research. They're entitled to do whatever they want and to regulate it how they want. And ultimately, they own the data. And I think that's a mistake that a lot of researchers and federal agencies fall into, is not realizing that this is the tribe's prerogative, allowing you to use this, and they get final say. So those are the big things I'd say of just an initial step.
Mm-hmm. Yeah, I think that's a great suggestion. And can you tell me again the name of the organization that you mentioned?
Sure, that was the National Congress of American Indians. I don't know if they still do the training, but I thought it was a phenomenal training.
Okay.
And they, yeah.
Great. And another person in the chat is recommending regional tribal epidemiology centers. That also might be a good point of initial contact when you don't even know how to get started. That might also be another point of initial contact. All right. Fantastic. Well, I think that we should leave it there on that note, because we only have a minute or two to the top of the hour, and we always like to leave that minute or two for people who have the back-to-back meetings. It was fantastic to hear more about your work, Gwynne, and we will absolutely put up the video and the many, many links. This is a really small slice of a big project. And thank you so much for taking time out of your very busy life, where you're playing so many important roles. We really, really appreciate it. And hopefully you can see in the chat that there's lots of appreciation coming your way. And for everyone else who's joining us, thank you so much. Talking Data Equity wouldn't happen without this fantastic community of people asking great questions, sharing cool ideas and resources. And if you're in the United States and you're looking at a long weekend, I hope you really enjoy it. And we will be back on Friday. So I'll see you next week, and take really good care of yourselves and each other. Bye, everybody.